Is it a procedure that you can die from?
When it comes to BBL, yes. If it's injected on the wrong place, through the bloodstream, it can go as an embolism. It makes it interesting. Like, I'm going to have 2 weeks of fun and have my breast job done in the same time, where I go home and I still save some money if I'm doing it in,
so I go for
Germany
a 5-star
or wherever.
holiday, I come back with a better looking cleavage and everybody lives happy.
And I'm saving money.
Hi guys, my name is Khulile Singata. I'm an anesthetist by profession. Welcome to my podcast. And the reason behind this podcast is because I've got an interest in public knowledge and informing people about things pertaining to their health. What I do now is I take experts in particular fields and then translate all of their rich wisdom and knowledge into a language that is quite understandable to everybody else, so that people can be quite knowledgeable. And yeah, basically that's it. And today I have got Dr. Al-Nabi, who is a plastic surgeon that I actually work with. And we're going to be talking about things pertaining to plastic surgery and a lot of information, because I know people are so interested about things that have to do with their beauty, things that have to do with how they're shaped, how they look. And today I think it would be a good idea for us to bring us into perspective on what actually plastic surgery is about, and all these procedures that people keep flying to Turkey and Singapore and all those places too. So, Dr. Al-Nabi, welcome.
Thank you. Hi, thank you. Thanks so much for having me here.
Yeah. I think the first question that I'd like to actually ask is, everybody, when they think about plastic surgery, they think looks, glitz, glam, make me have Chinese-looking eyes.
That's you.
As I always say
you are the only one who
As I always say in theater, you understand, like, that stuff. But what is plastic surgery about?
Plastic surgery, like, okay, if we're talking about the term plastic surgery, where it comes from. Okay, we know that medical is, most of the terms are Greek terminologies. So that's where, what is the terms being used in medical. And if you're looking at plastic itself, plastic means plastico. Plastico, that means like a problem-solving surgery or specialty. Let's say that from the Second World War II, where there are a lot of devastating injuries and patients, they like life saved, but they have injuries that has been pending for long and no one looking, like they saved their life, but they can't function as a normal human with the disfiguring or whatever function problems they have, devastating injuries. That's, I think, that's where the surgeon, with the interest of solving those problems, that's the birth of plastic surgery, starting with, like, and that's in terms of plastic. These days, plastic moved from two parts, where you have a reconstructive part, where you're solving the problems, trauma, burn, injury, cancers, and there's a static part where you're trying to enhance and improve the shape. So
which is the part that a lot of people are interested in.
I think that's the most, yeah, that's the one, exactly.
No, I do understand. But just a little bit of background from your side, like, how long have you been in plastic surgery?
From the time I finished medical school, I knew that I want to be a plastic surgeon. And the whole time I've been doing training just to get to the point that I finish and I be qualified as a plastic surgeon. And you know better than how long it takes that journey.
No, I know the journey, but you know how I always say to people, like, I feel there's two departments in medicine. There's anesthesia, and then there's others. And then in everything that you could have chosen to do in others, you went for plastic surgery. What's the one thing about it that strikes you, you know? Okay,
so why I choose to be a plastic surgeon, if I can put it in another way, it's the diversity of the surgeries. Like, I'm not disrespecting anyone or underrating anyone, but once you are like, I think it's the same for anesthetists, but once you are a pediatrician, you're treating kids, whatever the specialty, like a gastroenterology, respiratory, or hematology, or oncology, but it's still like, this is your main focus, it's a kids.
Yes.
If you are orthopods, you are an orthopod. You can be like a knee, a wrist, but you are an orthopod or spine, but you're still orthopod there is a lot of problems that side. But with plastic, that one day you're sorting out a bone problems, the other day you're doing a kitty, the other day you're doing a lady and an old man, and then a burn, and there is a cosmetics, and there is a reconstruction.
Yes.
So the diversity that keeps you always interesting and reading and looking for things different and challenges. That's what's beautiful about plastic.
And at least for me. What's your favorite part in plastics? For example, what do I enjoy? I enjoy hearts. like my favorite. If you take me to a procedure that has to do with the heart and the lung,
Okay.
that's a vibe for me.
That's a vibe for you. But let me ask you another question, or rather you asking me, I'm going to ask you. If they give you a heart surgery every day, won't you get pissed off with that and tired and you want to do a gynae or a neuro or a kidney as a type of change and challenge? I mean, like, you can't eat bread and tuna every day. You will miss the egg and mayo one day, you know?
Yes,
I mean, like,
yes.
you want challenge.
But you know, like sometimes you can have a potato on Monday, it can be chips. On Tuesday, it can be mashed. On Wednesday, it can be potato salad.
But you will miss the beef one day.
No, I get you. So, I mean, I like that. I like neuro. I do a lot of brain, for example. I like spines. Well, that's part of neuro. And all the other stuff, you know. But like, if you were to do, if they were to tell you that you only have to do one part and this is it, like
then I wouldn't be a plastic. I want plastic to have different types of things. Yes,
okay.
But no, I'm enjoying every part of it. Like,
you enjoy every part of it. I understand. And what's the hardest part about being a plastic surgeon?
Understanding your patients. Each patient is different from the other. And what they want is not the same. So it's not like you're having the same problem with this patient. You're going to do the same procedure or same things. Let's say like a breast augmentation, or you're going to do the same size, like the same. No, every patient is individual, is special, is different from the other. Like, you cannot treat them the same. And you want to understand your patient, and you be in the same wavelength and in the same page, and you can be in the same vibe with the patient. That's, I think, the biggest challenge when it comes to plastic. Like, that you need to know what they want, what they're looking for. You need to be like ready and available for them and for all these questions they want. You need like 100% available, address all the issues with them, expectations, what they're expecting, what they want, explaining the journey from A to Z, because it's like a journey. It's not like a one day and go home and that's done. It's a journey from day one you meet them for the first time till they are happy and done, and they don't want to see you. They just want to enjoy the life.
Yeah.
And then you can say that this is successful.
So one of the things that I find people are finding as a challenge is you have a lot of people, particularly in the whole area of body augmentation, you know, BBLs, breast reconstructions and all of that. People are flying abroad to have these procedures actually done, you know. And I know that there's a lot of plastic surgeons that are actually present in the country and all of that. What's your take on that? Why are people leaving the country and going abroad?
That's a good question, actually. There are great surgeons everywhere here, and they're one of the best all over the world. That's a good question, actually. But why I think it's the budget they give. Like, if you're looking at, let's say, Turkey, where they have like a medical tourist, and they advertise in it as a medical tourist, and where it's looking at comparing to the prices, and that's actually it's a government approach, not only the medical. So if you're looking at the price of the rand, a lira, the currency is a lira. If you're looking at the exchange rate between euro and lira, how much is that? And then you can understand what is what is the approach they're achieving. So the procedure is going to cost in Germany, let's say, a 20 or 40 euro, 40,000 euro. And with that price, they can, not that price, half of that price, they have a touristic little 5-star accommodations, and they have a week of tourist level experience where they have everything is available from the airport to the hotel, back to the surgery, to whatever, like a luxury they experience for that week, and back to home with the half price of what she's going to pay for that procedures. I think that's the approach they're achieving.
So it's not necessarily an issue of people in Turkey are better than them.
No, it's not about better. No,
it's
not about better. It's about pricing and what you're offering. And the second thing, actually, that goes both ways, because there is a people, and there is the commentary actually was done about those, like a touristic medical tourism, what they call medical tourism, and there was done, I think, I'm not criticizing Turkey or Singapore or any country specifically, but it's everywhere. But when you trying to save money and you're trying to go for a place, because just like the price, let's say the normal price in your country, like let's say 100, and then they offer you to do it with the 40. And they give you 3 days accommodation. So what they go there and they did the surgery and they go home, and then they have a complication. And when they try to contact that facility, it's gone. There is none. There's nothing. So, I mean, like, if you want to do it this way, do it in the right way.
Okay.
You need to find the right doctor, the right place, well recommended, that is does exist after a month. It's not
Yes.
like taking you in and then disappear after you leave.
So I've actually had a couple of experiences with people who have gone, and the few that I've encountered, I mean, they came back with good outcomes. They were fine, but like, what happens when things go south?
That's the problem. When things go south, then there is nothing. Then you
So,
find.
but don't they arrive here and then, because they will have stayed there for a couple of days, and then after that they're gonna fly over to South Africa, right?
Whatever.
And as soon, or wherever, whatever country that they're going
Come
back
from,
to.
yeah.
And then when they arrive there and there's particular complications and everything, do those areas have sort of like people that they liaise with, like, or do you have
No.
to take over a complication and then you are the one who's actually supposed to sort it out?
There is nothing actually. Most of them, they have no any connection with the country that you're coming from. So you go by yourself and you are on your own when you come back home. And when you go back to your home, then you need to find another doctor, and now he needs to explain to him what was done. And unfortunately, they go home without even a documentation like what was done.
So they don't have post-op notes and plan and what was used.
Just TTO, just a TTO for whatever pain medications they give
Just
them.
treatment
whatever.
to take at
but
home.
what is like what type of approach they did, and what is the procedures, and what is an eventual if something happen, or there is nothing. They just came with. So I mean, like that's where the challenge comes. If something goes south, it's the government policy, like the
Yes.
exchange rate, make it cheaper.
Okay.
And the facility they offer, like 5 stars and everything from A to Z, it's all budgets included.
Okay.
It makes it interesting. Like, I'm going to have 2 weeks of fun and have
then
my
have my
breast
breast
job done in the same time, where I go home and I still save some money if I'm doing it in,
So I
let's
go
say,
for a
Germany or
5-star
wherever.
holiday, I come back with a better looking cleavage, and everybody lives happy.
And I'm saving money.
And I'm saving money.
That's
I
the thing.
see. I
Like,
see.
like a hair transplant. I think almost taking over of the hair transplant industry in general. Like, and if you're looking at it, like,
So they actually are taking over now. Yeah. Who needs a breast augmentation? The reason I'm asking this is because you've got people who come in and they just want it for aesthetic purposes and everything. But like, are there situations where a person, like, you look at them and then clinically they require one?
everyone can have a breast augmentation, but does everyone need a breast augmentation? I mean, like, what I mean.
At what point do you decide that, okay, you need your breasts to be reduced?
Okay. Patient is not happy with the shape or the look of the breast. Okay, that's where it starts. I'm not happy with the way it looks, and I want to make it bigger.
Okay.
Okay, but then when you see the patient and examine the patients, I receive some emails asking about breast augmentation.
Yes.
But the question is like, it cannot be done by email.
Okay.
I can understand that you're not happy with the shape or the way it looks, and you not feel confidence, you're not happy with it, whatever. And then when you see the patient, that sometimes you feel like it just dropped because of pregnancy, like mommy, like a part of mommy makeover procedures. Like, you need just to do a bixie. There is a volume. It's just the skin envelope is loose. So then it's dropped down. The shape is sagging.
Okay.
So, and there is a volume there. And if you tell her, like, if we're doing a bixie or just lifting and addressing, and you show her, are you happy with that size? She was like, yeah, that's exactly what I want.
So some just need a little bit of tugging and lifting.
Exactly. And the others, like, I want to make it a little bit bigger. And that's where it comes with the other procedures. Maybe how big it you want to change, from which cup to which cup. Will a fat graft work? Will you want the implant? Or what other things we can do? So that's something that you need to discuss with the patient and see where she is and what she's looking at and what she's expectation at what she wants.
Okay.
And then you to give her the options and what you recommend. And from here, then we can talk and take it from there where you want to go.
And then in terms of timing, particular for women of childbearing age, right? Do you always recommend that people should finish having their children, or they should?
No, not necessary. Not necessary. No, not
So
necessary.
if a person has a breast augmentation procedure today, and then they fall pregnant, what's that going to? What impact is that going to have?
Okay, I would say, like, if patient
on
wants,
the aesthetic.
I have a patient ask the same question, okay, like a week ago, and I would say, like, if your family is not completed and you're thinking of having a kid next month, or like we are now in September, and you're thinking of having a child by February or January next year, I would say, don't do the surgery now. Because the pregnancy, hormonal change, and then lactating is going to change the shape. And you're going to, after all that journey of from pregnancy and breastfeeding finish, you won't be happy with the way it looks like. It's going to be saggy. It's going to change. I would rather, like, if you're thinking of having a child in this year, finish,
Have
do
your
it.
child.
Have your child, breastfeed, and finish that. And then
Yeah.
after that, you're going to need it, and you do it once, and it's over, done. If you and you ask me about what patients, like, there's other patients that they need a breast augmentation, like congenital problems, where they have, like I keep saying, they are sisters, they're not twins. So you can see that there is one that's well developed and the other is poorly developed and very small in size. That's something that you need to look away from congenital anomalies that comes with the breast shape and size. That's something as well different from just cosmetic. It's what we call the reconstruction part.
The reconstruction part. Oh, okay. And then I suppose because not everybody has got a life where they can actually plan, but okay, now I'm going to have this, now I'm going to have kids at this stage. Some people are single, you know? Some people are banking on these breasts to get a husband.
No, the thing is that
So it's that there's a lot of dynamics that play into it. What I'm trying to come to is that in the event where a person now falls pregnant and they've had a breast augmentation surgery, should they breastfeed?
No,
Is that going to affect?
definitely.
Is that going to affect how they?
it depends on what type of procedure. If you're talking about, let's say, a fat grafting procedure or minor or BICSI procedure, like a lifting and reshaping, that's not affecting. In general, doesn't affect. If you're looking at breast reduction, when you come to breast reduction, because that's different approach, and then I would say like it's going to affect type of how smooth is the breastfeeding will
What's
be.
a plexi? What's a breast reduction?
Okay, if we're talking about BICSI, it's just a lift.
Okay.
So what, we're not.
So you haven't changed. You haven't removed a lot of tissue. You've just
we're not removing,
lifted it up and
reshaping
given it
the
some-
breast. So the
Okay.
breast volume is happy. The patient will be happy with what the volume she have. We just need to address the shape of the envelope, reshaping the breast, and give it more youthful appearance by lifting, reshaping it up, make it looks nice. And reduction when it's a lot of tissue and it's heavy, and she wants to get smaller. So that's where we need to remove part of that breast tissue and reshape it and lift it, of course. It comes with a lift, but that's just the difference is one, you're removing part of the breast tissue because of the volume. It's a large. You want to make it smaller.
What do you do about the problem of scarring?
But I didn't tell you about breastfeeding here.
Or the
For that
breastfeeding
one,
part?
breastfeeding,
I
the breastfeeding, it won't be as smooth as without surgery, but you will be able to breastfeed. And then different pedicles had different advantage. One day be like able to breastfeed like a 70% of like a normal, 60%, 80%, 50%.
So it
That's
might
difference.
reduce your breastfeeding capacity.
She will be
but-
able, but yeah, exactly. She will
Okay.
be able to breastfeed, but it's not
Okay.
smooth as it. If she had the child before, it's not as smooth as.
Does it make a
previous one.
difference if they don't breastfeed when they've had a child?
I feel like every woman should breastfeed her child.
Me too, but like just for
I won't
knowledge
say-
purposes.
I'm not
like,
saying anything here.
it's
No,
just-
no, they
it's
should,
just,
they should breastfeed, but that's their call
Okay.
to make. I mean, like we're not here to
Yes.
judge. They
But
can
if they
feed.
don't breastfeed versus breastfeeding, does it make a difference in how the shape gets altered?
It's still gonna be. It's okay. So the breastfeed is gonna be more prolactin hormone producing, and more prolactin hormone producing is more milk and more engorging and deflating, and that's gonna affect longer. The process of that is gonna take longer than if she doesn't breastfeed, where there's no more hormonal and it's gonna come back and then it's done.
Okay.
So the longer the breastfeed, the
But
longer
you have to take into
hormonal change.
consideration what you are denying a child versus the
Child-
aesthetic you're
is
going
it child
for.
right or woman right? I think that's a tough question.
No, but I get you. But like, it's sort of like giving people like perspective so that when people are considering all things, then they can, particularly a tough one being discussed by men.
Exactly. No, true.
Yeah,
True.
so that's fine. And then on the healing point, particularly because in our country, there's predominantly a bigger population of color and people being prone to scarring and developing keloids and all of that. Do we tend to have more of that? And is there a way to sort of like try to abut that?
Okay, so the easiest part to have an idea about where it goes, I ask patient usually, do you have any scar? If you have a cesarean, let me see where is a scar, any scar in your body. It gives me idea about how she's healing, how is her tendency of wound healing. Cesarean section scar, if she have it and healed nice, most likely the surgery scar is going to be almost similar to that one. And that's give you, is it hyperpigmented, hypopigmented, is hypertrophic, is it risk of keloid tendency? If patient have a risk of scarring and bad scarring, whatever, that's make it risk of surgery might have a scar, and patient needs to accept that or be aware of it. We need to highlight that very clear. Away from that, usually the procedure is, I'm not saying painless, but it's more like a discomfort. Most of the pain is we're talking about breast now. Huh? Yeah. So like a mild pain that managed with the mild pain medications, and they do well after that, they will be able to function, walk around. Takes 3 weeks to 6 weeks to settle, and she can go to being very active in life.
How long does the recovery period take?
A recovery, 3 weeks to 6 weeks. 6 weeks. I mean, like if your patient is active and going to gym or running, I would say take it slow. Like we won't say the patient shouldn't go to gym, but in 3 weeks' time, she can go and do exercising lower body before she's going for upper body lifting and heavy work. In 6 weeks, she should be fine, but that's that's not the final shape. The final shape takes longer to settle.
And how long does the final shape take?
At least it differs from person to another, but we're talking about 6 months to 9 months. Sometimes even a year to have
even
a
year
shape.
For them to have that eventual shape that comes out of it.
And patient thinks if they have a surgery, they can go braless. No, bra is your best friend.
The bra is your best friend, so you need to actually wear that bra to actually keep everything.
The bra is your best friend.
I see.
Just choose the right bra.
for that. Oh, okay. All right.
Soft
cool.
bra, no wire.
No, that's quite cool. That's quite cool. Okay, let's take things a little bit lower.
Low. I like your approach. Like starting from top to low. Okay.
No.
What is lower?
So no. One of the things that they do also is not necessarily just breast work. There's BBLs. You know. What techniques are available for changing people's shapes? You know, some people want to be anything from whatever shape to
That's funny.
literally something.
That's a good question. The best technique of changing is patient mind setting and changing lifestyle and being ready for change and working for change. Some persons, some they think that I just go to plastic surgeon, they will fix.
And then my life's going to be good.
Yeah, but it doesn't work this way.
Yeah, that's very important actually, because I always think about it in the sense that I take a lot of interest in issues pertaining to exercise, weight loss, drugs like that. And what do you do with high BMI patients that are coming in for procedures? Because some people are of the impression that if I get a little bit of liposuction and then a little bit of breast work and then a little bit of this and that on my nyash, then I'm going to be good. Like, what I want to understand is, like, in patients that are overweight patients that still need to take a little bit of attention on, you know.
Let's take obese or overweighted patient. Okay? Usually you check the BMI, and BMI is the relationship between the height and weight.
Between the height and the weight,
okay?
yes.
So if you're looking at the BMI, and it gives your average, is it like a normal weight, underweight, overweight, or obese? And the obesity there's 1, 2, 3, and how far is that?
So you've got that patient that's going to be sitting at, let's say 29 makes you overweight.
Yeah.
Then once you reach 30, you're obese.
Yes.
And then it flies
30, but
to other.
There is a average range that you can help patient working on the patients, and it's safe. If we're talking about a patient with a BMI of 35 or 40, I mean, like, that's a high risk for the patients. And what we're trying to achieve here, he or she coming for a procedure. What type of procedure? I have patients before with a massive weight loss. When they come, their BMI is dropped very, like, let's say it's 35 or 34. It's still high, but they already lost like a 60 kilo.
Significant amount
Like a 60
of
kilo
weight.
of weight. So this patient needs, and now he have a panel sitting on the front leg, and when he or she, actually both of them, and when they go for exercises, it's holding from running and walking, and it's life activity is difficult for them, dressing the shape, even with walking. So this patient that you need to help him take that part, to push him to do more. And even with the chest or the abdomen, whatever the part, that's just to give him the push, and then he feel better, and okay, this part is over. So now he feel like he's motivated to do more and lose more, and that's the right patient. And there's other one that he comes with 100 kilo and he wants a liposuction to just make him look nice. That's like, I'm sorry. That doesn't work this way. This patient is not serious, or he doesn't. And the other approach, where they have a centers for massive weight loss between a surgeon, dietitian, psychology, psychiatric, nutritions, the whole team.
So a multidisciplinary approach.
Team, yes. And that they assess the patient from day one with the consultation, what his expectation, and take it from there, whatever balloon, sleeve, the operations technique they use to decrease the amount, and then the nutrition support with the gymming, exercising, physio, everything goes together as a package. And he's losing weight, and that one part, plastic, assists with that access skin and subcutaneous tissue and weight to reshape. So this two different things. There's a patient, they did the whole job by themselves, by just getting the stamina and the mind sitting that I want to lose that weight, and they lost from 120 to 80 or to 70 by themselves without any intervention. And there's other where they struggle and they lost like massive weight, was like talking about like a 90 kg. And that's with the assist of multidisciplinary approach, where they help them with the balloon or sleeves, and actually some of people get flying overseas to get the balloon because it's cheaper that side.
Because it's cheaper that side.
The procedure or sleeve.
Oh, okay.
And then step by step. That's if you're talking about massive weight loss.
Yeah. No, I get it. And then you were talking about it takes about close to like 6 months to 9 months, maybe a year, for breasts to take shape. And now I'm thinking about things along the lines of Brazilian bum stuff, BBLs, right? With fat grafting versus contouring and all the stuff, what lasts long? Like I wanted you to give us a perspective on, here's a person, they're coming in, they want a particular shape, right? They want to look like a pear or whatever the thing.
So I would say if someone is, the core is the most important. I mean, like if the core is there and to make it looks better, it's easier job.
Okay.
But if the core is not there, it's to change it from A to Z. It's not. It's a mission. It's not easy. If you get me.
Yes. No. I get you. So it's sort of like in a situation where it's almost flat.
Yes. So if you're looking about the BBL.
Yes.
One of the approaches is they putting implant.
To put in an implant, okay.
That's a foreign body, and I'm not fan with this. I'm not saying it's right or wrong. It's an approach, and it's there, and it's working. Not for me.
Not for you, okay.
Not
so that's not necessarily something
my approach
that you,
here. My approach here is a fat graft.
Fat graft, okay.
Fat graft is a better approach. I feel it's your body, it's your fat, it's more integrated in the body. It's shaping better than the implant, and less risk.
And how long does it last? It stays like that, like.
So with the fat graft, it stays. It goes nowhere. The only thing is that it needs multiple sessions. Like if we're doing the sessions to get perfect shape, and like if we're doing for BBL or for breast, usually takes more than session. You're doing first session, nice shape, and then 70% take, 30% loss. Okay. It's like it dissolves the fat itself. Okay. Which body absorbs.
And it's not necessarily symmetrical, even the loss. You might get loss more on the other side compared to another
That's
side.
other challenge, to symmetrize. So you always try to symmetrize to make them look like the same. And that's the fat grafting. First session, volume. Second session, add the volume. Third session, just to reshape, make them more like a smooth shape, symmetrical. Like so, fat grafting, that's one of the things that might takes more than one operation, takes 1 or 2. Sometimes even 3.
And what are the biggest complications that come with that?
With what?
Fat grafting.
That's one. It's not a complication, but it's something that patient needs to know, that you do the surgery with the fat grafting, you might take a second one, or even third one if it needs to be, to get like a perfect shape and size.
Is it a procedure that you can die from?
When it comes to BBL, yes. If it's injected on the wrong place, if it goes to wrong place, through the bloodstream, it can go as an embolism, fat.
So if it goes into your blood vessels, then...
That could go as an embolism, and it goes to lung, it can go
blocks
serious.
the lungs, and then
it can
you
go serious,
can't breathe well.
It can get serious complication with that.
Okay. And that is a complication that you can see like immediately now, right? that usually happens quickly. But like, are there, because a lot of people always talk about that stuff causing people to stink, like people will smell bad and all of that. What's your take on that? Do BBLs stink? Do they smell? Like, will a person walk around with an odor and all of that?
No.
Or is it usually an issue of
No,
there was a
usually patient
complication?
can take shower after that, after surgery.
So it's an issue of hygiene. I see. No. There's a lot of waves that have been going on, like
no, the
on
patient
social
can-
media,
no,
that so and so did a BBL.
No.
They stink. They licking stuff.
No.
You know, all of that.
So the thing is that there is a post-operative care, which is part of surgery. So patient needs to be compliant with that instruction, like the way they sit and how they sit. Because if you're talking about BBL, you're not gonna sit on the area that it was grafted, because the
I
shape is
see.
gonna be, the fat will be still
It'll be smudged.
smashed. Here we
Yes.
are, and it's gonna distribute it in a different place, push to another place, so the contour is not gonna be smooth. So you need to have that approach. It's a journey, and post-operative care is as crucial as the surgery. So you need
It's
to
a
be
lot of work.
compliant. It is.
It's a lot of work. Like people
Yeah,
have to do that.
beauty is not
You can't
easy,
sit like this. You can't sit like that.
Yeah, to have that shape takes effort. So patient needs to be ready for that,
I see.
willing and ready for it to accept that.
What's that? Somebody once asked me something about vampire facials. Is it a...
Yeah. Okay.
Do those
Vampire
things-
facelift.
What? How does that work?
This is actually Kim Kardashian and the social media things. I think it's more about those influencers, whatever. Like now, I can.
Because people are saying it's my blood and whatever is in there. What do they actually do? What
You know
what does it entail?
What is the funny thing? The funny thing is that social media these days, like, people have access to social media, and everyone can post on social media. It doesn't matter, like anyone, like we posting
It's
now.
not vetted through anything. It's not a randomized controlled trial.
No. It's anyone
or it's
can
not a
say
good
whatever.
review.
No,
Nobody
no.
can.
Yes,
Yes, nobody
exactly.
can vet all the stuff that is going in
And
there.
the social media and the influencers, like usually whatever they do, it's became a trend. Like if you're looking at a superstar, Hollywood star, whatever stars, they follow those guys, and they are like whatever they do, they want the same. And they give them the name based on whatever it's done. Like, oh, that was like a newspaper written guy. She comes with some bleeding spots on the face. It's like, oh, she comes out of that shop like a vampire's bite,
so
and this become vampire facelift. It's like a PRP, plasma injection, like a small needling to the face, and that's gonna give like a enhancing collagen, hyaluronic acids injected and plasma. So they give tightening and shaping of the face, and that's when they wrote it in the newspaper. It became the name as a vampire facelift. It's a technique now. It's called
It's a
vampire
technique.
facelift. Yeah.
Does it work? Does it work better than others? Or
It's not a facelift. It's not technical facelift. Does it? Okay. So how does it work? It's type of regenerating to the facial skin and subcutaneous tissue by doing those micro needling or injecting plasma or PRBs. It's like enhancing collagens, hyaluronic acids, and stimulating, like it's like a small needling to the micro fibroblast cells, and it works by giving the youthful shapes by stimulating this. It's like if you want something, you make it to heal, and enhancing circulations, and now more production of collagen fibroblasts and hyaluronic acid, and that's gonna give like a more tightening to the face.
Yes.
So it's good to have that, and if you have that and you do that, that's good. And if you keep doing it regular, it's gonna keep you a youth longer. If I'm doing that when I was 30, and now probably you're gonna see me saying like, oh, you look like a 35 or still 32 when I'm 40. So that's how it works.
So it does have some
but
benefit.
At one point, the thing this comes both ways. The other day, the other guys that they doing fillers, as the other hand, it's a volume space. And that's okay. Let me not go that
Fillers,
direction.
no.
Let me
I'm
not go
actually
that direction,
interested.
because it's gonna go to the facelift, and then we're talking about if you.
No. It's actually an interesting one, right? But like fillers, for example, I don't understand how they actually work relative to the other stuff, because
It's cross-linked collagens with the hyaluronic acids. Okay.
Yes.
So because
so
what,
it's
what's,
not that
what
it's
happened?
more synthetic stuff that is coming in to fill in a space that was wrinkling.
What's happened as we get older? We're losing collagens. We're losing hyaluronic acids. We're
Hyaluronic
losing
acid
volume. We're
and-
losing fat. We're losing all these things. It comes slower. Elasticity of the skins. So that's how we get sagged and our skin qualities change. Your skin quality is not the same 20 years ago, and mine is
Sad.
not the same, unfortunately. We can't run away from it. And that's why you can see this is he looks like a 25 years old. He's like a 6 years old. It's just by looking at the face, how it looks. So if you talk about fillers is different type of fillers, but then the base of the fillers is the hyaluronic acid.
Hyaluronic acid and collagen.
The cross-link is different in how it's cross-linked together. And where it can be used. Is it for volume? Is it for a lift? Is it for, where you putting it on the lips, on the zygoma, maxilla for a volume of millers, or you want, and the Botox is different from the fillers. How it works? It works by enhancing the rejuvenating the skin and subcutaneous tissue to give the whatever lost the volume, the water, the collagens, the fibroblasts, the hyaluronic acids.
Okay, so what I'm getting is that you inject that stuff and then it stays.
Not forever.
Or does the body sort of like reabsorb it back and all of that?
Yes.
Okay, because from what I understand.
Yeah, and stays, but not forever, and it's absorbing by the bodies and stimulating the body to produce, but it's having effect for roughly a year, let me say.
Roughly a year. Okay, so you have to keep on going back. Versus Botox, somebody once asked me if once you start Botox, you're going to have to do Botox for the rest of your life.
Why? This is not an addiction. You can, if you want, you can have it. If you don't want, you don't have it. But what is the Botox? What does it work? What is the difference between, if you say Botox and filler? Filler is from the name. It's filling the space.
It fills in the space.
So basically, you're injecting something, water, call it hyaluronic acid, call it collagens, call it whatever you want, but it gives volume. And if the lips is flat, you want to give the volume. And there is a name for that. And if you want to have the a Miller filling and it's dropped, but one of the things as you aging, this one is getting flatter and dropping. So you need to get that volume of the Miller minices or Miller bags and get injecting that volume. That's a filler from the name. I mean, just to make it simple. Botox is the botulinum toxin. It's affecting the muscles, it's doing paralysis to the muscles. So this muscle is moving. The more movement and the longer movement and the stronger movement ends up with the creases.
I see.
And if you want to prevent those creases, you need to block those muscles.
You block those muscles and then they don't contract a lot and then you form less creases.
They form less creases. And that's where the things, if you're going to make it simple. And if you want to make it more complex, that's crease, you can do a Botox and filler where you can block the muscles and it's not contracting and fill the crease if it's severe. So there's interaction between how you use both of them, but there's a place for Botox, and Botox could be cosmetics, it could be therapeutic, by the way. It can be very therapeutic for other diseases and other problems where you need to block the muscles. A migraine, one of the migraine can be treated as just simple hyperhidrosis. It can be treated with Botox.
Yeah, and
what it's like hyperhidrosis, it's like you should ask me what is hyperhidrosis. It's more excessive sweating.
Excessive sweating, yeah, and some people even go for laser for that or have procedures, cut nerves in order to stop. It looks like things are getting complicated as time goes on. Where do you see the future of plastic surgery, particularly the aesthetic side?
Okay, so if we're looking at what is the goal, what they're trying to achieve with the...
Everybody wants to be young.
Exactly, to be young forever.
Forever young.
Forever young. Yeah. Okay, that's the goal, okay? That's what they're trying to achieve. Are we getting there?
That's the song he always plays in theater, by the way.
I love
Forever
that song,
Young.
Forever Young. It's one of the iconic songs, by the way. Anyway, so Forever Young. Yeah. We wish that we can stay forever young, okay? And that's all what we're trying to do, try to make people look younger. We cannot keep them young forever. We just make them look younger. If you ask me about the future of aesthetic surgery or cosmetic aesthetic procedures, try to achieve that. To have a treatment for getting old and stay young forever. Would it be possible? I think with the science and going to the stem cells.
Stem cells.
I think there is a hope.
There's a lot of development from the stem cell side of.
Stem cell side things is engineering. It's mind blowing now. It's I won't be surprised if it's something will be in hand in the future.
I see. So you would advise us to start saving our children's stem cells now and keep them and bank them now so that when they need them in the future, they're there.
No comment. I don't know.
I see. So if there was one thing that you would say to people as a take home, what would it be?
Okay. A take-home message. Okay. I think the changes comes from you first. Doesn't come from having plastic surgery or looking for a plastic procedure. The change comes from the person himself.
The knife is the last phase.
Nurse can assist, but doesn't make the change. It does make a change, but the change must come from you by knowing what you want and what you're trying to achieve. And you already start the changing. If you want to lose weight or you want to shape, but there is things that you can only do it with knife, that we know. But if you're talking about my single advice, eat to be young forever. Eat healthy, exercise, no smoking, no drinking.
You're going to offend a lot of people.
I'm sorry, that's the truth. Truth is ugly, you know?
Yeah, no, that's a reality. That's a reality. I mean, like at some point.
And sleep early and wake up early.
If you are counting on, it's like
no,
cars.
Actually, I found something interesting. When I say exercising, it's a good, yes, definitely. There's no doubt about that. But what type of exercise we're talking about? I've seen, when I went to the gym before, and I've seen like a guys or whoever doing weightlifting. And the way the facial expression, and I'm seeing that muscles like different. Everyone doing different shape. Like if you are in the cis, you're doing either that face or you're doing. The more it's happening, the more you're strengthening those muscles, and the more that the dominance is going to be. And that's going to change.
Okay.
And you're looking at older one that you've been doing this for longer, and you see how that muscles or how that action affected him.
So even the expression when you're exercising, even the expression has the potential to actually change.
And stress-free.
I see.
Stress-free is that. Okay, this is the eat healthy, exercise, even walking, simple exercise, be fit, eat healthy, drink a lot of water. Sleep early, wake up early. Like you see the birds, when they sleep and when they wake up, match them.
As soon as you hear a chicken make noise,
then you wake
out
up.
of your bed.
And when they sleep, you must sleep.
Out of your bed. Yeah,
and stress-free, stay out of stress.
All right.
Difficult, huh?
Yeah. No, it's a very hard one, but like it's doable, particularly if you're a person who's counting on riding your body for a longer period of time. You know, I always look at it as if you buy a car and you are driving it 200 kilometers a day on gravel, then there's going to be an issue with mileage. There's going to be an issue with tires. There's going to be an issue with shaking, you know. But if you are treating it right, like as a person who would like to still have it and in that condition, that in the ideal condition, then it's best to actually take care of it.
If you're thinking of your car this way, so your body deserves more, no?
Yeah. I mean, I think the most important thing is that you stay in your body longer than you stay anywhere else. So,
but we're looking after your cars more than your body.
No, I don't look after my car, but I'm looking after my body.
But listen, if you're looking at something, when you're talking about exercising, have you seen the athletic or the guys who are playing Olympics, or even like a random guy who's doing being fit, being athletic, like not overweight, not like massive weight, just normal weight and healthy, and how they look? They look always younger.
Those guys look younger actually than people who...
He's not exercising or is like not fit.
Yeah.
Exercise is it's the thing.
I mean, it does a lot because it contributes to early sleeping and early awakening and better
releasing
sleep patterns
and releasing
and
stress,
improving the quality of collagens underneath your skin, hyaluronic acid, and the whole stuff about inflammation and stress response. Yeah, that is quite good. Well, guys, there you have it. I mean, it would have been nice to talk about more stuff, but at some point we have to terminate it. So if people have got questions, maybe you can pop them in the comments, and then we'll see if we can find time to give you the answers. Until next time.